running man. Every day I'm running man. Chasing all these hundreds that my pockets feeling funny, man. Hey, running man. Every day I'm running man. Your girl and your wifey and her sister wanna love a man.
Welcome to Murse Incorporated. Today's guest I have with me today is
Antonio.
This is my preceptor. He's been working in critical care for
3 years.
Yes. And the topic today, he's gonna tell us about his background, how did exactly he got into nursing, right? You can follow us on YouTube at Murse Incorporated or Murse INC. Make sure you follow my Instagram at Murse_INC601. You can follow me on Snapchat at PoloKing324. And you can also follow me on Instagram on my personal channel at hard_2_love, and the E is a 3. You have an Instagram?
I do, but I would not encourage you to follow me.
That's fine. That's cool. I understand. That's just gonna make people want to follow you more. But outside of that, I hope you guys enjoy this episode. And again, the title of this video is going to be How You Became a Nurse. So you just describe to us your journey.
Well, I will start off by saying that a lot of people like to say that their journey is unique. However, I'm finding that my story is not as unique as I once thought, especially the longer I stay in this noble profession. Becoming a nurse was never really even a thought for me. I originally thought that I would go to pharmacy or medical school. So when I graduated from high school back in 2008, I enrolled at Southern Miss, University of Southern Mississippi in Hattiesburg, SMTTT, as a biological science major with an emphasis in general biology. Well, I will say that I wasn't the most serious student. I was late teens going into my early 20s. Really thought I knew a lot about life, which I did know a good bit about life, but not to think, I will say that I wasn't really just putting those lessons into practice very well. My grades slipped, ended up on academic probation, academic suspension, had to go back to the drawing board, graduated from Southern Miss with a biology and a psych degree with a minor in chemistry with a very low GPA. The GPA that I graduated with did not truly reflect my utmost potential. So that was, I will say that's been one of my biggest regrets, one of life's biggest disappointments. I'm not going to say life's biggest disappointment, but more so my biggest disappointment to myself. So I took it, after I graduated from Southern, I worked as pharmacy tech because I did a lot of research and I seen that pharmacy schools were a bit more forgiving than medical school, especially if you showed that you had real work experience in that area and you were willing to go back and retake some courses and truly prove yourself. So got a job as a pharmacy tech, worked my way up to lead tech with a couple of different companies, all while still keeping my goals and my dreams in the back of my mind. Let's see, I remember I went and spoke with, I won't say at the time, William Carey had either just admitted their inaugural class or they were getting ready to admit their inaugural class for the William Carey, back then William Carey College, College of Osteopathic Medicine. And that's another subject for a different day, but osteopathic and allopathic medical schools, there are 2 tracks. And osteopathic medical schools tend to be a lot easier to get into. Most of them are private, and the GPA standards, I'm not going to say they're lower, but they are sometimes not as competitive as the traditional MD track. So I went and So with that in mind, I went and spoke with one of the directors of admission there. And looking at and I took my transcripts, took everything. And they told me with the damage that I'd done to my GPA, that I had a less than 10% chance of getting into medical school, which was quite an emotional blow for someone, especially at this age. At that time, I want to say I was maybe 24, so still very young, still in my early 20s. But I will say that conversation was not completely, I'm not going to say that it was pointless. It wasn't a completely negative conversation, because it was there that I started, the person I spoke with, he and I started a dialogue on what were my options. And I come from a family where there was an array of different, where I was exposed to a variety of different working professionals, blue collar, white collar professionals. And I was looking at all the things. I was like, well, I could chase down the pharmacy, becoming a pharmacist. I could chase that dream, or I could look at some other things that I have one of my bachelor's is in psychology. I could get a master's in social work and become a clinical social worker. I could possibly go to law school. But all of those, I mean, yeah, they somewhat appeal to me, but not the way that being a doctor or a pharmacist did. And I worked, by then I had a couple of years as a pharmacy technician under my belt, and I enjoyed learning about different drugs and how we use them to not only sustain life, but we also use them to make life better, restore homeostasis. But there was still something missing there. I knew I wanted to do something where I would, where I had more people, where I had more interaction with people. So I talked to my cousin, who at the time was getting ready to apply to nurse practitioner school. And she said, what do you think about nursing? And she's not the only nurse I have in my family. I have quite a few nurses in the family. And she was like, okay, what do you think about nursing? Because she also got a bachelor's in psych, a master's in psych, and a master's in business before she went to nursing school. So somewhat similar tracks there, but her grades were much better at Southern than mine were. So took it into consideration, started doing my research, and I was like, hey, the biology and the psych degree fulfill most of the prerequisite requirement. The only thing was the GPA, but I was like, okay, nursing school, it may be a whole lot easier to get in nursing school than medical school. And once I become a nurse, if I like it, I can always move into a healthcare provider role. There's nurse anesthesia, there's nurse practitioner, there's schools of nurse midwifery, if I wanted to go that track. So started doing the things that I needed for nursing school, including taking A&P. I had to take A&P and retake micro. Well, getting into nursing schools proved to be quite a challenge. I was denied from 6 different nursing schools when I first applied. So I started saying, okay, maybe this is not going to work. I started looking at grad school all over again. So I started looking, I was applying to RN programs at this point. So I went to Hahn on a whim one day while I was in Jackson, visiting some family members, because I was still living in Hattiesburg at the time. And I drove by Heinz and got out and started looking at and talked to one of the admissions counselors. And she was like, she was telling me once again what other nursing schools had told me, make me quite difficult for you to get in RN school, although you had great ACT scores and you had a bachelor's degree. Your grades were terrible, but your nursing prereq grades were good, but the overall picture was not the best. And so she told me, have you ever thought about maybe applying to LPN school? I will say that was a humbling experience. I'm not going to say it was humiliating experience. I would say more so it was a humbling experience. I was like, LPN versus why can't I be an RN? But I had to understand that I had to own up to the things that I had done. And let me tell you, saying yes to, like, okay, I'll apply to LPN school. That was the best thing that I could have ever done. Best decision that I ever made. Because I got into LPN school and it provided me with so many mentors and so many learning opportunities, and it also gave me the opportunity to be influential. Not only did I get something, but I felt like I was able to give something as well. Even got scholarships along the way. Graduated from LPN school with a 3.76 GPA. I missed having a 4.0 by 1 point on my final in my last semester. I needed, and I still remember it to this day, I made a 93 and I needed a 94. And so that caused me to get a B for my last term for my LPN class, but I still managed to graduate number 1 in my class. Through all of that, I still stayed in contact with those who took care of me during LPN school. Got out of LPN school and took a job for a urgent care company in this area, in the Jackson area. Once again, one of the best decisions I made because it provided me with very positive role models and mentors, including fellow LPNs, RNs, as well as advanced practice registered nurses, family nurse practitioners. And they got there and I hit the ground running, very ambitious, and they were able to love me and take me as I am, and my willingness to learn and my hunger to do better and know why. And they taught me a few things and encouraged me to go back to RN school rather quickly. So that would be the latter part of 2016. That spring going into that summer, I would apply to the transition to RN program once again at Hines Community College. And let me tell you, a lot of people don't think about this, and this is also for you college age people and, well, anybody in college, period. Please take your college education seriously, because here's the thing, the more hours that you accumulate, once you get past 65, 70, going into 80 hours, the less your GPA moves. So wherever your GPA is at that point, that's where it tends to going to stay, and it's going to take a whole lot to pull it up. So I'll say let's take it. Look at it this way. I graduated from LPN school with a 3.75. 3.75 GPA. That still was not enough to pull it to where I needed it to be. But I'm a person of faith. I believe that God always sends you what you need when you need it. And he will make ways. Because here's the funny thing about this story. The summer that I was about to apply, the spring that I was going to apply to the transition to RN program at Hines Community College, they dropped the GPA requirement by 2.25 points, which gave me a little more wiggle room to actually apply. I actually not only met the requirement, but gave me a little bit of wiggle room. So I was like, okay, most definitely I'm going to get in. And they gave me points and credits for my bachelor's degree. So I was like, most definitely I'm going to get in. Time rolled around, I did not get accepted. So I had to wait until they did orientation for the program to see if people didn't show up. So I was waitlisted, and I was number 5 on the wait list. Well, 4 people didn't show up to orientation, so 4 people from the wait list got in. So they put me at number 1 on the waiting list, but they were saying I would just have to reapply next year. I basically didn't get in. I will never forget, I want to say it was May 30th of 2018. That was the first day that class started for that program. Class started at 4:30 that night. They called me, the lady from Honda called me at 2 o'clock and said, could you be here? Someone decided at the last minute that they did not want to do the program. I said, I don't have anything, I don't have any uniform, none of that. All I have is, I cannot wear just my work scrub. And they said, yes. And I'm always grateful because Hans said yes when everybody else said no, and I'll never forget that, and I'm always grateful for that. So I started my RN journey. Journey to RN school, graduated from RN school with a 4.0 GPA, working as well as taking care of my grandmother who had recently been diagnosed with cancer in my last 4 months of my program. From there, took NCLEX, passed NCLEX, and took a job in a medical intensive care unit in one of the hospitals in the Jackson area. That proved to be quite a challenge in itself because nursing school and this nursing world allowed for me to build my confidence again after I had failed in previous, I will say, eras of my life. And coming into critical care, I was rather ambitious, and I will say to a fault I was a bit arrogant because I thought that I would come in here and master this thing called nursing, critical care nursing, in 3 weeks. But no, it didn't work that way, and I'm still learning every day, still learning even 3 years later. Came with this fair share of growing pains, and I put myself in a very uncomfortable position, I will say knowingly, and also ignorant to my own arrogance, because you going into a critical care unit as a new grad, you are actually taking on a huge challenge, an enormous challenge, because not only are you having to learn basic nursing, but you're also having to learn critical care simultaneously. So my preceptors had taken on a challenge of having to make me a nurse, a safe nurse, and teach me basic things, all while trying to teach me critical care at the same time. And I'm forever grateful for those people who have taken me under the wing since I've been working in critical care. Fast forward 3 years later, I'm proud to say that I'm doing my part in taking it forward and paying it forward. I precept and I charge in my unit. I'm oftentimes looked for assistance from some of the newer nurses. I still find myself going to the people who taught me, because like I said, you're always growing and you're always learning, and I think that keeps me grounded and keeps me humble. Not every day has been a great day, but I would say every day has been filled with its own unique and invaluable lessons. I think so. That's my story. That's how I got here. I don't know if I inspired someone or if anybody listening or taking anything from what I said. I'm just me.
Well, Antonio, just listening to your story really inspired me. I'm sure whoever sees this video, they would truly feel inspired.
Oh, thank you.
I can remember before we even had this video, or before we started recording, you was nervous, and
of course I don't do this every day.
Yeah, but in the same instance, it's just I can see it related to just me starting this channel. Like, how many views am I getting? Maybe like 15, 30. But everybody starts at ground zero. I don't even consider square one. You just start at ground zero. You start right down the bottom of the floor, and you work your way up. And you have bumps in the road. Just you being my preceptor, you have given me tremendous knowledge and tremendous insight. And sure, I can admit I forget a lot. But at the same time, it's the fact that you are still willing to give your helping hand, and you're still willing to say, I understand.
That's part of what nursing is, and don't ever forget that. Those things are very, I take those things very seriously that are part of our profession. They're always talking about, we always, especially in our training to become nurses, the profession as a whole emphasizes continuing education and leadership, and those things are important. I mean, these are a set of ancient skills passed down. I mean, it just didn't start yesterday, and the cycle has to keep going, and the only way we keep it going is the fact that, yeah, you're new now, but even though you may still feel sort of new, even after your first year as a nurse passed, look at it this way, you still know something that someone else doesn't, or you know more than someone. You know more than this new nurse that maybe graduated yesterday. So it's your responsibility, should that nurse, or should that new nurse, or should that nursing student approach you, you provide them with something. I take that very seriously, because even though I had those people who poured into me, I still have those instances where people did not. And that's just it sometimes. But I make a conscious effort not to be those people. I try to be like how people were, the people who actually poured into me. And some of those people, even some of my nurse instructors and program directors, I still communicate with them to this very day. So my only hope is for you that on your own unique journey, that you don't forget this time, because you will have to refer back to it when it's your turn to give something to someone. And I hope you make the decision and the conscious effort to be the person to give back, and not so much turn your head or ignore that person.
Well, I can make you this promise right here in front of the Bible, right here in front of the 30 or so viewers that we have, hopefully the thousands and millions of viewers that we potentially can have, that all the lessons that you have bestowed upon me, I will bestow upon the next generation, the next set of nurses that come in within this upcoming year, within the next 6 months. Because in order to retain information, you have to be able to teach. You have to always stay a student in order to become a teacher. But I know this video may have been a tad long, but please, if you guys can try to find Antonio's Instagram, look for it.
Please don't.
And follow him.
Please don't.
Thank you for watching. And yes, sir, we are Murse Incorporated. You can follow me again at Polo King 324 on Snapchat. You can follow the Murse Incorporated channel at Murse _INC 601. You can follow the Instagram channel, well, my Instagram channel at hard _2 love, and the E is a 3. I really hope you guys enjoyed this video, and please stay tuned. Please like and subscribe, and leave comments for future topics, and have a wonderful day.
Running man, every day I'm running man, chasing all these hundreds that my pockets feeling funny, man. Hey, running man, every day I'm running man. Your girl and your wifey and her sister wanna love a man. Hey, running man, every day I'm running man, chasing all these hundreds that my pockets feeling funny, man. Hey, running man, every day I'm running man. Yo.